Morning. Thank you, Riyadh, for hosting us again this year. Thank you, Saad, Nadim, and Dr. Pignon for encouraging us and helping us to come here. And a special thanks for Fakan from Alfaisal, also for following us for our visa procedures. Thank you. So I will do an update about the radiation therapy status in Lebanon. This is my outline. So as you know, Lebanon is a very small country. We have a population of about 6,800,000 people. 4 million are Lebanese, and around 2 million or more are refugees. The incidence of cancer yearly is about 11,000. This is the number from 2020. And we have the 5 most important cancers are breast, lung, prostate, colorectal, and bladder cancer. We are expecting a rise in the incidence of cancer by 2025 to reach around 2,100 cases per year. So this is the distribution of the radiation therapy facilities in Lebanon. We have all over 12 centers of radiation therapy by last year. This year we have 10 centers of radiation therapy because 2 are closed because of a lack of service and the maintenance contract. And as you see, all the centers are gathered in the Mount Lebanon area. We have a big part of the country, mainly the Bekaa and the north part of the country, that are underserved with radiation therapy facilities. Most of our centers are private. So now we have 9 private radiation therapy centers out of 10 functional centers. We have 16 machines in use, minus 2 machines from last year. We have 15 radiation oncologists, 8 medical physicists, 16 dosimetrists, and more than 50 RTTs. Almost all the centers that do the new techniques are located in Beirut. We have a big problem of geographical distribution and a big problem of financial coverage. We have a high out-of-pocket for the treatment and coverage of the treatments. We used to have 3 units of AGR afterloader, but now we have only 1 unit that is still functioning. So if we compare the radiation oncology manpower between 2019-2021, we have lost a lot of radiation oncologists, medical physicists, and dosimetrists. But from 2021 till today, we are stable. Our main problem are the RTTs. We have a high turnover of RTTs, and we're not able to retain our RTTs. So we are using the skilled personnel, and this is slowing down our workflow, because by the time we are training new RTTs, we are losing them again. In terms of equipment density and age profile, so by the guidelines for Lebanon, we need, if we take into consideration the treated number of patients per year, we need 14 Linacs. We have 16, so it's a density of 4 machines per million. But these are numbers that are apparently assuring. In fact, our machines are aging. So we have more than 50% of our machines, they will be 10 years or higher. We have 2 machines that are pending installation. So our needs for 2027 are 4 new Linacs. So as you see here, Lebanon, we are in the good zone for machine density, but our machines are aging. If we consider the density, we are good for 4 million people, but if we include the refugees, we are not good in terms of machine density. We are treating around 5,500 patients per year. So those numbers are estimated because we lack of National Cancer Registry. And even in our National Cancer Registry, the data for radiation therapy is not included. So those are data I asked center by center for the centers who agreed to give me their data. So if we calculate the RT utilization rate, we are below the 50 or 60% threshold. Our peak was between the year 2019-2020, and now we're around 36% of radiation therapy utilization. And I think that this is a super estimated number because our incidence of cancer is higher than 15,000. So the number of patients treated varied a lot from 2018 till now, and it's partly related to the events we lived in these last 4 years in Lebanon. So between 2018 2019, it was the honeymoon for the oncology in Lebanon. We had a rise of referral to radiation therapy. And then we had the economical crisis, the Beirut port explosion, and the COVID-19. So we see the number that are peaking down. And then we as not expected, because we were expecting a trend to down. But in early 2022, we saw our number rising again, despite the economic crisis. And it's mainly due to the shortage in chemo and immunotherapy and targeted therapy. So the patient that were taking, for example, Tagrisso, once the Tagrisso is not available, they recurred again and they were referred for radiation therapy. And that's why we saw our number rising again despite the crisis. I will share the data from my hospital, which is the biggest hospital in Lebanon, the North Lebanon Hospital. As you see here, the distribution between techniques. We started our SRS program in 2019, and we see our numbers of hypofractionation, SRS, and SPRT treatments are increasing. We still have some 3D treatments because we treat our breast with 3D conformal, and 50% of our workload is about breast cancer. We still have a lot of gaps in our equipments and techniques in Lebanon, but fortunately, we'll have 1 unit of adaptive treatment ethos that will be installed during the next year. So what are the challenges? The never-ending economic crisis, just to give you an update. So we have an inflation rate of 229.85%, and we have a phenomena, which is the stagflation, which is worse than inflation, is the inflation with a recession. So there's no horizons to foresee for the next years. We have an unemployment rate of 40%, and the Lebanese part was devaluated by 98%. So last year we presented a mapping about the barriers to access to radiation therapy in Lebanon. It was mainly 3 reasons: the low referral rate, the financial problem, the high out-of-pocket rates, and the lack of public transportation, knowing that the distribution of the centers were in one part of the country. 3 years after, it is true that our machines are aging. We are unable for some centers to pay our maintenance contracts, but in another part, we are also installing new machines. It is true that most of our centers are private, but it was a blessing during this crisis. We have higher referral of radiation therapy despite of the crisis. People are more poor, are unemployed, but are still coming to radiation therapy. We had the fuel crisis, so we were calculating the cost to come to radiation therapy sessions. But the most important problem was the loss in human skills. We are losing our physicists, we are losing our technicians, and this is a very big burden to us. So again, what are the challenges for a country living a severe economical crisis and on the verge of an armed conflict? How to provide sustainability in radiation therapy services and renewal and innovation. So this is my proposed plan to sustainable radiation therapy services in a country living a crisis like my country. First, we need an important effort to be done for data collection, like a National Cancer Registry, and we were working on this, and a dedicated database for radiation therapy in order to provide adaptive tailored policies and research group. We need to work also for equipment maintenance, like subsidizing the contracts for maintenance to limit the downtime. And this is the role of the public-private partnership for machine renewals. We need to work also on manpower training in order to do a retention for this skilled human resources, and it's important to improve their working condition, standardizing the practice through RT national guidelines and multidisciplinary teams, quality and safety treatments through annual strict certification for centers, and working also for pricing negotiated with third payer to improve affordability of the treatments. And here, I want to finish my thoughts for cancer patients in zone of natural disasters. armed conflicts, climate change, pandemics, economic crisis. And I think that these challenges are not only for Lebanon, these are for all the Middle East area. And this is our responsibility in Mestro to provide support for these population in order to ensure and provide sustainable radiation treatment in this area. I'm grateful to be at Mestro's second version. It's an opportunity to gather forces, consolidate regional partnerships in order to reshape and standardize the practice of radiation therapy in the Middle East. Thank you very much.